I was really surprised at how I felt about intimacy after the ectopic. Hey guys, it's Maggie and I am back today, and in today's video, I've been thinking about this video for like, I don't know, a week, not that long, but I've talked about this subject in terms of all of the different health things I've experienced. So today I want to talk about intimacy, but in relation to having a current ectopic pregnancy. Obviously I don't have one right now, but I did about 2 months ago, and intimacy, I didn't know what to do with. I've talked about intimacy in terms of having an ostomy and, you know, having my husband and wanting to be intimate. And I've talked about it in terms of proctocolectomy surgery. So I think that was the most impactful thing on my intimate life, was not having a colon, particularly not having a rectum. That changed a lot of stuff that I didn't realize. So I will link those videos below because I do often get asked about this. But this video is going to be talking about just the ectopic experience and how that impacted my intimate life. If you're just tuning in for the first time to my channel and you're like, what the heck is going on? So I live with a permanent ileostomy bag. That is how I go to the bathroom. I no longer have a colon or a rectum or even an anal sphincter because of Crohn's disease. I've gone through many surgeries. And so getting married and planning for a family, I knew that there would be likely be some issues. And it turns out that there was. My husband and I got married about 3.5 years ago. Pretty much started trying immediately and nothing happened. So this past February, I think that's when we started going to the fertility clinic, like seriously getting treatments. My first round of fertility treatments was a medicated intrauterine insemination, and it worked, and I got pregnant for the first time ever. Unfortunately, it was wonky from the start and turned out to be ectopic. I want to talk about intimacy during that period as well as after, really probably focusing on the after more so, because you become scared of your body. I don't know, like I've been in that situation many times where, you know, I have surgery and things change with my physical body and I have to relearn how they work, and you feel very uncomfortable, you feel really scared. And so when I found out that I was having an ectopic pregnancy, it's actually something that nobody told me. I wish, you know, a doctor had said, you want to avoid intercourse. No one had told me that, but it was kind of like an instinct. I have since looked it up. It's pretty, you know, cut and dry. Everyone says avoid intercourse if you are experiencing an ectopic because it can increase your chance of a rupture. And that's what I automatically did anyway, thankfully, because I was just so afraid of what was going on with my body, and everybody was telling me, take it easy, don't move around too much, don't lift too much. I thought that intercourse probably would not be super helpful, especially if you know, we weren't really sure, we weren't 100% sure where the ectopic was, but it's usually in a fallopian tube, which is where it wound up being. I'm glad that that's just what felt right. And I still, the way, you know, my ectopic was treated was medication first with methotrexate injections. That unfortunately didn't work. We thought it was, but it wasn't, and I wound up rupturing at home. I look back to that day and I'm like, what the heck? Like, did you do something to cause this? And that day, I remember I was doing basically nothing, but the one physical thing that I did that day was it was storming outside like crazy, the wind was blowing, and we had our trash cans up at the street, and they were blowing down the street. So I got up from being lazy, just sitting around, got up, went outside, and dragged the trash cans back in. And it was shortly after that I started to have pain. So I'm like, is that what did it? I'll never know. But because of that, obviously, I wound up having to have emergency surgery. I have been down the surgery road before, so it's nothing new to me, and because of this, I have had issues with scar tissue. I've had scar tissue a lot of places inside of me. It happens because I've had so many surgeries. During surgery, they've removed a lot of scar tissue before, so I knew it could potentially be an issue. And that was really the scary part, being in the ER, talking to the surgeons that would be performing my emergency fallopian tube removal. I didn't know how it was going to go because of this, and they were really worried because they were not the ones who have, you know, done surgery on me. The hospital was not the one that did surgery on me, so they were rushing to get surgical notes from other hospitals, and, you know, it was ultimately decided, we're going to give you a C-section incision. We're not going to do a laparoscopic because we don't know if we'll be able to get in there, and if we do the laparoscopic and we can't, then you're going to get a C-section incision anyway. So let's just go straight for the one incision. It'll be large, but we'll be able to do the surgery. And so coming out of that, you know, recovery from surgery is scary anyways, and usually, in my experience, you're not feeling up to any intimate moments with your person. So, you know, you want to give yourself time to heal. But at my 2-week post-op appointment, that was like the only question, the first and only question I had for the doctor. I said, can I have sex again? Like, is that okay? Kind of, you know, was beating around the bush. I don't think she expected me to ask that, but I was curious. I wanted to know if it was safe being so soon out of surgery. It had also been a while because this whole ectopic experience, from trying to medically treat it to rupturing, that was a long process. Even before, when I didn't know for sure that it was ectopic, there was the thought that it might be, or it might be a chemical pregnancy, and I was terrified to do anything to ruin it. So it had been a while. I wanted to know when it would be safe. So the doctor took a look at my incision, which was healing pretty well. I did have one area where it's a little funky looking, and even it's 2 months later now, I have one spot that there is a stitch or something that is not dissolving as fast as it should be, and it's a little funky. But after looking at my incision, seeing how well overall it was healing, how well I was doing, my pain level and all of that, I was given the okay. And, you know, it was scary. I was nervous. Being in the ER, when I was rupturing, they had to do this pelvic pain exam where basically they did a pelvic floor exam with, you know, the doctor's hand. Put it up there to see if I was having pain, and holy cow, I was having pain. I was having a lot of pain. And so I just had that memory. Anytime I was thinking about intimacy, I was like, is this now going to be painful? I'm not new to pain during intercourse because of my other surgeries, my proctocolectomy, really especially. I've had issues with the muscles down there tightening, and it's made intimacy a little bit of a challenge. Not anything that I haven't been able to work through with pelvic floor therapy and dilators and pelvic floor wands. There have been some challenges that I've had to overcome. So it was kind of like, am I starting from square one? Like, am I having to relearn how I work down there and see what is painful and what is not? So I really communicated with Zach, my husband, and I was like, we need to take things slow because I don't know what to expect. I don't know what I'm going to feel. I know what I felt in the ER just a few weeks ago, and that was terrifying and awfully painful, and I just don't want to associate that pain with intimacy with my husband. So we took it extremely slow. And if you're experiencing this, you've gone through the surgery maybe, and you're worried about this, obviously check with your surgeon. I'm just going to share my experience. I was really surprised at how I felt about intimacy after the ectopic. I don't know if, you know, maybe that right fallopian tube that I lost had something going on prior that maybe caused some issues. I don't know if maybe there's a little bit of nerve damage or something, but I have found intimacy afterwards completely comfortable. And I'm very grateful for that, especially since I had so much pain with the pelvic exams and then, you know, the transvaginal ultrasounds that I had during that whole experience. I was shocked. I really expected pain and had none. Around my incision on my lower abdomen, it's like fairly low, like right above the pubic bone basically, I have some numbness. It's just a weird feeling. I've had numbness around incisions and it's improved over time. Some of them, you know, it comes back fully. Some are still years later sort of numb, and I don't know what to expect with this incision, but I will say as of right now, 2 months out of surgery, it is still numb. It feels weird. It's mainly above the incision. Below is not too bad. And my ostomy, when I put my ostomy bag on and peel it off, it's sort of in the area on the bottom of my flange. It sort of sits on the skin that's numb, so peeling it off, it's like nails on a chalkboard. I don't know how to explain the feeling. It feels weird and I don't like it. It's not quite pain. It's just weird nerve feelings. So that's been interesting, but it makes me wonder, I don't know, was there something that was uncomfortable in there and the nerves are damaged and now I don't feel it as much? Who knows? But I will say I've been pleasantly surprised with my comfort level post-op. And obviously, it's hard. Intimacy is hard because, you know, obviously I want that with Zach anyways. But it's also what leads to having a baby sometimes, you hope. You may not hope, I hope. And obviously that's something that I haven't been able to do on my own. But then you go through this fertility process and it's considered a low-tech fertility treatment that I did, and it just gives you that inkling of hope that maybe some of your intimacy will lead to something that you can create on your own. That has not happened for me, and I don't expect it to, based on the 3.5 years that nothing happened. But it's something that, I don't know, it crosses my mind. I think this whole ordealio that we went through here, the mental healing of it has been a much bigger challenge than the physical. I think the physical was, you know, had a lot of pain immediately after surgery. It subsided pretty quickly and I was able to move forward. And to be honest with you, just sitting here today, I cannot tell anything different than before. This is not like when you have ostomy surgery or you have your rectum removed where, you know, you can feel things are different. You know, it's not like that at all. I don't feel anything missing. Nothing feels different within my body, which is honestly very refreshing. I'm used to, like I kind of said earlier, having to relearn how my body reacts and works and stuff, and I haven't had to do that, so it's sort of funny. It's like, did that even happen? Like, I see the scar on my stomach, but did that even happen? And then the whole mental side of it, where something I very much wanted is no longer here, that's what gets me. That's the part that is the most difficult. And every step has just been slowly trying to restart life, just like with intimacy. But that is my experience. I hope that if you are going through this, I hope that you are able to take the time to not just physically heal, but mentally do what you can to get better. I have mentioned this in many videos because I've talked about this a number of times now on my channel. It's very therapeutic for me to talk about it. But I forget, I don't know what just happened, but my brain just like looked that way, saw something, and then totally forgot what I was saying. If you are going through this, experiencing an ectopic pregnancy and maybe a rupture in surgery, I hope that you take the time that you need to heal in any and every way that you need to. It's, I think, one of the hardest things that I've gone through, and if you look at other videos on my channel, you'll see that I've had a number of health challenges. This is by far the hardest one that I have ever been through. I literally had my anus closed, and I was okay. I just, I had to do it. I knew it would make me feel better, and so I went through with the surgery and prepared myself that it would take a while to heal, and it did, and I made it out the other side. I don't know if it's because this was so unexpected, and it's really, it has impacted every piece of my life, but things that I didn't even think about beforehand. I didn't even think about how it would impact intimacy at all until I was in the moment, like, oh no, we can't do that. Don't touch me, Zach. Like, get away. I don't know what it's gonna do to my body. So, no. That was just one of the many things that I didn't even know it could impact, and it certainly did, and it's certainly nerve-wracking the first time that you want to be intimate with your partner after surgery. And my recommendation is just clear it with your surgeon, make sure you feel comfortable. If you have anything like a dilator or a pelvic floor wand, test the waters beforehand, see if everything is all right. I'm very grateful to say that it has been smooth sailing since, and I feel very comfortable, if not more comfortable, since I had this surgery, which again makes me wonder if something was already going on with that fallopian tube. But now I'm just gonna continue healing, and when I feel comfortable, I may go back to the fertility doctor and see what the future holds. But I wanted to talk about this today because it's something that really terrified me in the moment, and if somebody else is looking for information like this, I don't know how much information I really provided, but I can at least provide personal experience. Alright guys, thank you so much for watching this. I hope that you're doing great, and I will see you in the next. Bye guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel, like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.